One of the most common dental problems amongst individuals is called gingivitis. Surprising, right? But unfortunately, that is also one of the most underrated dental issues. Hi, I'm Dr. Neye, and in this video, I'll be talking to you about gingivitis. Now, you need healthy gums in order to keep your teeth in place, because if your gums are not healthy, eventually they can cause what we call periodontal disease. And in periodontal disease, it means that the bones underneath the gums get affected. And when the bones get affected, eventually you may end up having loose teeth. So yeah, your gums matter much more than you think. Now, what is gingivitis? Gingivitis simply means inflammation of the gums, and this can arise especially along the margins of the tooth. The gum around that area can actually become puffy or swollen due to the inflammation, and this can give rise to pain or discomfort. Now, the main cause of gingivitis is due to accumulated dental plaque. Now, this dental plaque is actually a soft, sticky white substance filled with bacteria that accumulates especially along the margins of your tooth where the gums meet the tooth. And that's why that area usually gets inflamed as the accumulation progresses. Dental plaque is what we take off when we are brushing our teeth, but they can accumulate in certain areas. Now, when they accumulate, because they are filled with bacteria, your body tries to fight it off, and this results in an inflammatory response, which gives rise to the inflammation. And of course, with the inflammation, you can have discomfort, pain, and sometimes gum bleeding. Now, healthy gum is actually pale pink in color, but some individuals can actually have some pigmentations, giving rise to a kind of darker colored gum tissue. The common signs and symptoms of gingivitis will include swollen or puffy gums, dark red gums or inflamed gums, especially around the margins of the tooth. Itchy gum, some people actually have some itchy gums. You can have gum bleeding even at the slightest touch, especially when you're brushing your teeth. The gums can actually become tender. Some patients can actually describe that they have some slight discomfort, especially when there is marked inflammation. And of course, gingivitis can also lead to bad breath due to the accumulated dental plaque. Gingivitis can be termed as one of the early stages of gum disease, and it should be managed early because treatment at this point is actually preventive. When it comes to the supporting structures of the tooth, you have the gums and then you have the bone. Now, with gingivitis, the early stage, just the gums are inflamed. Everything underneath the gum is intact. But if gingivitis is left to progress, eventually what will happen is the bone underneath the gums can actually become affected. Now, once this gets affected, it can no longer be reversed. If this is left to progress, you can eventually have what we call pockets. Pockets is a space that occurs between the gum tissue and the tooth. And when this pocket has been created, what happens is you end up having more plaque accumulating, more debris accumulating, and you can end up having what we call periodontal disease. When it comes to the management of gum disease, prevention is actually the best cure. Now, this early stage of gum disease called gingivitis is actually preventable and reversible. Practicing good oral hygiene is an important step to preventing gum disease. The first step will be brushing twice daily, in the morning and at night, for at least 2 minutes. And you should use a soft to medium bristle toothbrush. Now, don't be in a rush. Make sure that your toothbrush gets into every surface of your teeth so that you get an effective clean. Number 2 will be flossing at least once a day, especially at night. Now, flossing helps to clean in between your teeth so that if you have any accumulated plaque or food particles that are stuck in between your teeth, it can take them off. That way you prevent yourself from having gum issues or even dental cavities. Number 3 will be to schedule professional dental cleaning sessions. Now, we advise you visit your dentist every 6 months, at least twice a year. Now, there are certain areas where your toothbrush may not be able to reach and you may not know. So when you present to the dental clinic, an assessment will be made. And if there are areas where you have accumulated plaque or even plaque that has calcified, now, calcified plaque is called calculus or tartar. There are areas where this can accumulate and this can give rise to gum disease. So during your dental checkups, all this will be checked. And if you need professional cleaning, it will be rendered to you. In as much as we advise you get your regular dental cleaning or checkups done every 6 months, if you have a history of gum disease, we'll advise that you do it much more routinely, at least every 3 to 4 months, so that all these can be addressed as soon as possible before they progress into worse issues. We've come to the end of this video. Please be sure to like, leave a comment and share to your friends and loved ones. Also, kindly subscribe to my channel so that you know when I drop a new video, and I'll see you in my next one. Bye.